Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. Rural hospitals can leverage their unique status in the community to assume risk, align incentives, and coordinate care. Establishing a provider-sponsored health plan can strengthen their position in value-based care. Today I'm joined by Phil Kamp, CEO of Valence Health in Chicago, to discuss using provider-sponsored health plans to achieve value-based care in rural populations. Welcome, Phil, and thank you for joining me today.
Thank you. Glad to be here.
Why is value-based care important in the rural setting?
Well, generally speaking, value-based care makes sense in every environment, and really it's around creating the right incentives for providers to manage care appropriately. So in the rural setting, it's actually kind of interesting that it actually can be an easier setting depending on the life base that you have. But generally speaking, from a network standpoint, you usually have a complete network in a rural setting. So it can make it a lot easier to do it from that perspective as compared to an urban setting, which may be a very difficult thing to do from a network standpoint. So
Well, what are the challenges?
one of the issues is going to be around how providers are compensated in that marketplace. So if physicians feel they're compensated well, they're less likely to think about doing something in the value-based environment if things are going well. The same thing for the hospital in that environment. So if the hospital and physicians feel like the status quo was working for them, there's less likely or need for them to get into value-based care. The other issue is really around making sure there's enough lives to be managed, and we need a minimum threshold of lives to really make the program make sense.
So the assumption of risk does become an issue in that rural setting.
Yes, so there's different ways of assuming risk, by the way. So you don't have to go straight to full risk health plan. You can migrate into it. So you can start with an incentive program-based program, more of a P for P type approach, and then work into risk sharing arrangements with corridors. And in those situations, you start, I would call it training wheels. And so you start with learning how to do risk and then move along the risk spectrum as you move further and further into risk. The one thing that's interesting on the risk side from a provider standpoint that's different than an insurance standpoint, and I'll just use an example if I could. So if a patient is in a hospital, a rural hospital, and that patient costs $50,000 and the insurer would have to pay that $50,000 bill. If that same patient is in a hospital, the hospital has the risk contract, how much does it really cost that hospital provide care for that patient? 80% of costs for hospitals are typically fixed. So that patient really only costs an extra $10,000, and that's the situation that I just discussed. So there's really a lot less risk for a rural hospital getting into the risk business than an insurance company being in the risk business.
But what about the full continuum of care then? What if they don't have all the pieces to assume risk?
Right. So the risk really for the hospital is the care that leaves the health system, and that becomes the issue that they need to manage relative to the risk. So they need to either contract for some of those services with other organizations that provide that care. They can also get reinsurance coverage for the financial liability associated with that.
And what options are there for getting into a provider-sponsored health plan?
So there's several things one can do. So one can literally start your own plan if that makes some sense. The other option I think that's viable in certain marketplaces is multiple hospitals coming together, different rural hospitals, or it could be associated with an urban setting, come together to create a statewide or a regional-wide health plan. That also helps get away from the issue around the lives that you need to manage and the infrastructure that you need to build the organization. So that bringing several organizations together may be the best approach in managing getting into provider-sponsored health plans.
So when they go about setting up such a structure, do they usually use a third party to help them negotiate the process?
almost every hospital is in the rural hospitals certainly are in a situation they know how to manage their hospital. Now you're getting into the insurance business, and it's a completely different business. So I would highly recommend that they bring in expertise, probably outsourcing several of the capabilities relative to building this. You need actuarial capabilities. You need to process claims, not submitting claims. Now you're actually going to be processing the claims. Your member service issues, there's data issues, there's all sorts of issues that you need on the insurance side, and you should outsource some of those functions. For the provider organization, there are certain things that they should become very good at, and that's really around the care management component and the network management component. So when you think about it, there may be 100 different services that you need to do to manage risk or a health plan, but the management of the care and the management of the network is the core expertise that the provider organization should do. Outsource the rest.
What results can the CEO and the trustees of a hospital expect when they're participating in the provider-sponsored health plan? What advantage does it give them?
So one of the major advantages, if you're a provider-sponsored health plan, you're allowed to design, for example, benefits in the marketplace that meet the needs of the patient population. So you're at the first dollar. You can decide on what you need to do relative to benefits, how you pay providers. You're going to have a different relationship with the state and local governmental officials relative to how care is provided. You can get into the Medicare and Medicaid space. So your strategies may be very different in Medicaid, Medicare, and commercial. You may decide it makes sense to become a Medicaid health plan because of the rules in a particular state. It may not make sense to be a commercial health plan. So those are other issues that you need to address. So there is a strategic issue there that becomes very critical in getting into provider-sponsored health plans.
Thanks for joining us today.
Thank you. Appreciate the conversation.